Hi everyone and welcome back to my channel. My name's Sophie and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I'm going to do an overview of 3 of the 4 appointments I had at Cleveland Clinic. I will do the invasive cardiopulmonary exercise test in a separate video and just briefly mention it here. But the trip wasn't as useless as I was expecting it to be, which is obviously a good thing. So the first thing that happened was pulmonary function tests on Tuesday. And they only did spirometry, which is kind of a bummer. They didn't do lung volumes, which is more what I'm interested in, especially with the tracheal collapse, just seeing how much air is left in my lungs after I exhale. But anyway, the spirometry was normal, which I will come back to in a few minutes. And then I did a 6-minute walk test, which I don't really like their setup. It's just walking back and forth in a hall. And because of the autonomic dysfunction and then I have to slow down to turn, I feel like it's not completely accurate. But it was basically the same as it was last year, which I believe they say is severely reduced. And it was done without oxygen. And whenever I start to feel symptomatic, be that lightheaded or chest tightness, I would slow down. I think during the walk they average it out and it's 2 miles per hour. And normally when I do my walks around where I live, I average around 3 miles per hour with oxygen, but I'm also pushing myself to where I'm short of breath and symptomatic, so that's sort of the difference there. So I'm not really sure why they did the pulmonary function test and the 6-minute walk test, since I did not have this tracheal stent trial, but they said to continue getting it, so I did. Then, genetics. Genetics so far was the biggest waste. We'll see what happens. They did not trust the results from sequencing. They also did no research on sequencing because they said stuff like, oh, well, I don't know if it's done in a clinical laboratory, and I don't know about this and that, and it was if they would have just done a search on their website, they could have found those answers. But they did order another genetic test through a different company called Invitae for Ehlers-Danlos syndrome, which again, I already know through sequencing is negative. So not happy about spending the extra money, but it would be nice to get some sort of answers, and if this is the only way to get it through genetics, then that's what I'll currently do. I will probably be getting the genetic counseling through sequencing once I have enough credits, and that'll be a few more months still. That was it for Tuesday. Wednesday, I had a cardiology appointment, which I never think is going to go well because they normally don't, but it actually went pretty good. He was able to show me my cardiac MRI images and the echocardiogram images, which is really cool because I don't have access to those, and just sort of point things out. And I was able to ask the questions I wanted and just sort of stipulate I'm not trying to be difficult. I'm just one of those people that want to know everything. And he was very nice about it. He's no, you're fine. Let me bring the pictures up. Let me show you. So that was really nice. He also prescribed a new medication called Farxiga, which is often used in diabetics as well as people with heart failure. It works by sort of getting rid of sodium and glucose in the body. And considering I retain fluid like crazy when I eat sodium and glucose, I am hoping that this means I can stop this complete yo-yo with high sodium, high carb, low sodium, low carb, depending on how much fluid I'm retaining and on how lightheaded and dizzy I am with the autonomic dysfunction symptoms. So more to come on that. I will start it on Sunday. This video is going to go up Saturday. So I'll start it and then we'll see how it goes. He also said the contrast refluxing into the inferior vena cava and my hepatic vein, that was on the abdominal pelvis CTA is because of like fluid in my body, like too much fluid, as well as the complete brain fog. It'll come to me in a second. Anyway, another thing that was abnormal. My echocardiogram in April I had done with the blunted systolic pulmonary flow was also due to too much fluid. And hopefully Farxiga is going to help with that. So yeah, I was impressed that something actually happened. And this is a medication or a type of medication that we did discuss at my first appointment with him back in 2022. So it's nice to finally be able to try it, and we'll just see how it goes. I'm not too concerned about side effects. I am going to space it out from the Lasix. He did not tell me to stop the Lasix. So I will continue to take Lasix in the morning and not eat during that time because, again, I am very sensitive to sodium and carbs. And then I will take the Farxiga later in the day when I'm eating because, in theory, it should flush that extra out instead of me retaining it. So I'm kind of excited to see what happens about that. Then later in the afternoon, I had the invasive cardiopulmonary exercise test, or the invasive CPET, or the ICPET. Again, I'll make a whole nother video about it. In short, it went well. As you can see, I still have the bandage on from the right heart catheterization, and then I still have the bandage on from the arterial line, not because that one needs to stay on, just because my arm is very, very sore, and I will be going through TSA, and I just want to have a visual of sort of like, look, I had a procedure done, please be gentle with my wrist. And my neck is sore too. This is supposed to stay on for 24 to 48 hours, so I'll probably take it off. This is Thursday morning, I'll probably take it off Friday morning, Friday afternoon. And that's just to make sure that the blood clot that forms stays in place. But the thing I'll mention, because I talked about pulmonary function tests being normal, or the spirometry being normal, is they also do spirometry before the invasive CPET, and it was not normal. It showed moderate restriction, which is quite the difference from 24 hours earlier. So that is definitely something I'm going to ask the doctor about. There's lots I'm going to ask him about, but I don't want to make this video any longer than it is because there's a lot to go over with the invasive CPET, and I haven't decided if I'm going to go over what his note says and then do another video about more what's going to happen based on that, because that I don't have the answer to yet. So that's probably what I'll do. I may or may not record that this morning. I do have some time before I'm being picked up to go to the airport. And it would be nice to get it out of the way before I go home back to life. But yeah, the trip was not a waste. I am surprised, very surprised. But yeah, definitely more to come. And that's going to be it for this video. I hope whenever it is you are seeing it, you are having a good day, and I will talk to you guys next time. Bye, guys.